Hey, I'm Antony, physiotherapist, nutritionist, and functional medicine practitioner. Here at NxHLife, we translate science into empowerment so you can rise as pain warrior and take back control. Let me start with the question many people with chronic pain eventually ask. Why do anti-inflammatory medication work at first, but then slowly stop helping? Maybe you've experienced something like this. You hurt your back, or your knee, or shoulders. You take something like ibuprofen and other anti-inflammatory medication. The pain reduces. You feel relief. But weeks later, or months later, the pain returns. So you take the medication again. Sometimes it helps. Sometimes it barely changes anything. And eventually you start wondering, why isn't this working anymore? To understand that, we need to talk about something many people misunderstand. That inflammation is not simply a problem. Inflammation is actually a healing process. Now, when most people hear the word inflammation, they imagine something negative. Swelling, pain, redness, stiffness. But from a biological perspective, inflammation is one of the most important repairing systems the body has. When tissue is injured, the immune system sends specialized cells to the area. These cells remove damaged tissues. They release signaling molecules, and they begin coordinating the repairing process. Without inflammation, healing would not happen. So, if inflammation is part of healing, why do anti-inflammatory drugs sometimes help with pain? Because inflammation also produces chemical signals that increase sensitivity in the nervous system. Those signals help protect injured tissues, but they also contribute to the pain you feel. Anti-inflammatory medications reduce some of those chemical signals, which can reduce pain in the short term. And for acute injuries, this can be helpful. But here's where things become more complicated. Because the body doesn't just switch inflammation on or off, it also has to switch it off properly. For many years, scientists believed inflammation simply fades away once the injury heals. But modern research has shown something very interesting. Inflammation doesn't just stop on its own. It has an active resolution phase. In another word, the body uses specialized molecules to actively turn the inflammatory process off. These molecules are called specialized pro-resolving mediators, or SPMs, and they help guide the body from inflammation back to balance. But when the resolution process doesn't happen efficiently, something different can occur. The inflammatory signals remain active at a low level. The nervous system becomes more sensitive, and the body can become stuck in what researchers sometimes describe as chronic inflammatory signaling. This doesn't always show up clearly in blood tests, but it can influence pain sensitivity throughout the body. Now imagine what happens when someone repeatedly relies on medications that only block part of the inflammatory process. At first, the pain decreases, but the deeper biological drivers might still be present. So the underlying sensitivity gradually returns, and the medication appears to stop working. Not because the drug changed, but because the body's system is more complex than simply blocking inflammation. This is what I sometimes call the inflammation trap. The focus becomes, how do we suppress the signal? Instead of asking, why is the signal still active? Because inflammation doesn't just appear randomly. It's often influenced by multiple factors in the body, like sleep, stress, nutrition, gut health, hormones, metabolic health. Even psychological stress can influence inflammatory signaling. Your biology is a system, not a single switch. And this brings us to one of the three lenses we often talk about here at NxHLife: movement, protection, and biology. Biology lens looks at the internal environment of the body, the terrain that influences healing, things like inflammatory balance, energy production inside cells, the immune system, and how the nervous system interact with those biological systems. When the biological terrain becomes more sensitive, pain signals can become louder, even when there is no major tissue damages. Now, This doesn't mean medication is always bad. In some situations, it can be extremely helpful, but medication alone rarely addresses the full picture of chronic pain. And this is where many people become frustrated. They feel like they've tried everything. Different medications, different treatments, different therapists. But the pain keeps returning. Not because they fail, but because the system driving the pain may be larger than one single intervention. One of the most powerful things we can do is start asking better questions. Instead of asking, how do I shut this pain down? We begin to ask, what might my body be trying to tell me? Are there areas of the body that are under stress, is disrupted? Is inflammation being driven by lifestyle factors? Is the nervous system stuck in a protective state? Are there biological systems that need support? When we start asking those questions, the map becomes clearer. And once you have a map, you're no longer chasing random solutions. You're exploring drivers of pain. This is what the pain warrior mindset is about. Not fighting your body, not ignoring your symptoms, but learning how your body system actually works. Because symptoms are signals, they are information. And when you understand those signals, you gain the power to respond more intelligently. Now, if this conversation resonates with you, I've created a free guide called the 7 Unspoken Truths About Chronic Pain. Inside that guide, I explain some of the most misunderstood aspects of chronic pain and why so many people feel stuck in the treatment. You'll find the link below this video. And if you want to continue learning with others who are walking this path, you're also welcome to join the Pain Warrior community, a growing group of people around the world who are learning to understand their pain, support their biology, and rebuild confidence in their bodies again. Because healing doesn't always come from chasing the next treatment. Sometimes it begins with understanding the system behind the symptoms. You are not broken. Your body is communicating. And once you begin to understand the language of those signals, the path forward becomes much clearer. Let's turn pain into peace one step at a time. See you next time.